millions, yes, millions of people have been kicked off their coverage. Millions of people that were promised on multiple occasions that they would never lose their insurance, have lower premiums, and could keep their trusted physicians and doctors. A couple statistics as we get started today that I want us to remember. Close to 75% of state-run co-ops have completely collapsed. Now, what does this mean? Over 800,000 people were forced to find new coverage in a very difficult time. And according to Gallup, nearly 80% of all Americans want to change the law significantly or repeal it entirely. As we saw recently, that 80% now includes a Democrat governor and a former Democrat president who've heard the countless horror stories of small businesses and individuals alike. And just earlier today, President Obama shows up for the first time since lobbying the Iranian debacle in efforts to provide another arena that is equally as bad. Our goal in the RSC is to be proactive and fulfill the promises that we have made to the American people. We look forward to working with leadership and this administration in finding the solutions that provide opportunities for all of our communities. This is round one of a 15 scheduled round fight. Basically, as the conservative caucus in the House, our job is to bat leadoff. Now, the most impressive and the most popular alternative health care legislation, both in the 113th and in the 114th Congress, is Dr. Phil Rowe's American Health Care Reform Act. Who better to start this process than a physician who ran a successful medical practice career, who employed hundreds of medical professionals and met and dealt and provided health care to thousands of patients. Dr. Phil Rowe is uniquely qualified to lead our efforts to restore sanity to health care and change the focus of our system away from bureaucratic mandates to compassionate care for patients by trusted doctors paid for in a responsible way. Dr. Rowe.
Thank you, Mr. Chairman. It's a privilege to be here today, and I just want to mention a couple of things in reintroducing the American Health Care Reform Act. One, this was not my bill. This is a compilation of everyone's bill that you see standing here. I know that Austin Scott is here. Yeah, here he is, who co-chaired the last revision of this bill. Dr. Price, Mr. Jordan, Steve Scalise, Mr. Scalise, now the whip, and Bill Flores also brought forth. Mr. Flores was a previous chairman and really challenged me to write a bill that truly did lower cost and to increase access. And look, I look at the Affordable Care Act. I wanted it to succeed. I practiced medicine for over 30 years in Tennessee, in rural Appalachia. And I saw people who didn't have health insurance coverage. Our state, Tennessee, is not a wealthy state, and we had a lot of uninsured people. And we made an attempt in the 90s to cover almost everyone in the state, and it was a debacle. And Marcia Blackburn is right here behind me. We wrote an op-ed piece, which I would suggest you read, in July of 2010, I believe it was, on what happened to our state in our attempt at health care reform, and exactly the same thing has happened here. How did we come up with this bill? We wanted it patient-centered, where patients and doctors were back in charge of healthcare decisions, not bureaucrats, not insurance companies. So how do we accomplish that? Well, we sat down around the table, and let's look at the principles, the conservative principles that we look at. What do we agree on? And those things are the following. First, we agreed to repeal the Affordable Care Act because it's not working for the American people. Number two, we looked at how do you make health insurance cheaper? Well, for small groups and individuals, that's what we were actually talking about. And that small group individual market, you can do that by the following. One is to allow people to buy insurance across the state line. It's Marcia Blackburn's bill. And a perfect example of that, if any of you watch the ads, is a very cute ad that Geico has, where it has a little gecko standing in the middle of the street. He has 1 foot over here, he jumps over. Guess where he jumps over to? Tennessee. His other foot, he jumps over to Virginia. That happens to be in my district. Why in the world can you buy car insurance like that across the state line, and yet you can't purchase the same health insurance plan that would be good in both places? If you found one cheaper in Virginia, you lived in Bristol, Tennessee, you should be able to buy it. Two, allow people to have an association health plan. Number three, massively expand health savings accounts. Our group started with health savings accounts when they first became available. I still have one. It puts the consumer in charge of their health care. We desperately need as an obstetrician who's delivered almost 5,000 babies, and by the way, I delivered a lot of my own voters. One of the ways that we know that medical liability reform is essential in helping lowering healthcare costs, and Andy Barr is going to speak in just a minute on that. Transparency is incredibly important is in this bill, is that we as consumers don't know what someone is paying for a service, what you're paying for. Well, how in the world can you negotiate when you don't know what you're actually paying? So that's in there. We realized and except in the small group and the individual market, pre-existing conditions were actually already taken care of by rules and regulations that occurred and were passed back in the mid-'70s. So in the large group market, in Medicare and Medicaid, pre-existing conditions weren't relevant, but they were very much so if you passed out of that market into the individual market. So we look for very high-risk people. We fully fund high-risk pools, which we had working in the state of Tennessee until Obamacare came along, which allow people in those pools. For instance, I saw a lot of patients that had breast cancer. Through no fault of their own, they had a very severe, highly cost center pre-existing condition. It allowed those folks to buy insurance at no more expensive rate than you could in that market. And repeal of McCarran-Ferguson, which is an antitrust exemption that insurance companies have. And I've heard Austin Scott and Dr. Gosar talk about this at length, that we will not ever be able to solve this problem without amending that. With that, we'll take questions in a minute, and I have a 7-page, basically the bill. I wanted to show it to you. It's not 2,500 pages. It's 184 pages long, which you can read in less than an hour. I guarantee you, it took me days to read the Affordable Care Act. At this point, I'd like to introduce one of my colleagues and very good friend and member, Dr. Larry Bouchon, who's a cardiovascular surgeon from Evansville, Indiana.
Well, thank you, Dr. Rowe, and it's a pleasure to be here today. We're here today because we understand that this isn't just a debate about policy. This is a deeply personal debate on behalf of the American people. It's about their health and well-being and that of their families and their loved ones. As a physician, my goal is to ensure that every citizen, regardless of his or her circumstance, has access to quality, affordable health care. It's a goal that we all share. That is why we're working to bring relief to families and deliver a new approach that drives down costs, increases access, and keeps patients in charge of their own health care decisions. Now, I'm sure that earlier today, the Democrats and President Obama did their best to devise a new political strategy or a new catchy slogan to convince the American people that Obamacare is working. But the American people know that it isn't. It's a new slogan that can't cover up the pain and hardship people are experiencing personally. Obamacare is unaffordable. Families are paying more for worse coverage. In many cases, deductibles are so high that families have essentially catastrophic plans. Obamacare limits patients' access to the health care system. Providers are dropping out, and physician networks have been limited. Obamacare limits patient choices. Contrary to the president's promise, we found out that you actually can't keep your health care plan even if you like them. And Obamacare has made substantial cuts to the Medicare program, jeopardizing the promise made to our nation's seniors. House Republicans had a productive conversation with Vice President-elect Pence this morning about our plans to bring relief to families from Obamacare and ensure that every American has access to quality, affordable health coverage. Republicans are united with the American people on this front. And this legislation from the RSC can serve as an important framework for our committees and our members as we begin to work through the legislative process to replace Obamacare. President-elect Trump was right this morning when he said the failures of Obamacare fall on the shoulders of the Democrats who passed it without a single Republican vote and forced this law on the American people. So I hope they'll work with us and ditch their efforts to protect the law at all costs and partner to deliver real reforms that drive down the cost of health care, increase the quality of care, and expand access. Now I'd like to yield to my good friend from the 6th District of Kentucky, Andy Barr.
Thank you, Dr. Bouchon and Dr. Rowe, for your leadership in crafting this legislation. And in a former career, I practice law defending physicians and hospitals and medical liability claims, and also working for a law firm that represented plaintiffs in medical malpractice cases. The core principle, the core objective of the Affordable Care Act was, of course, as the name implies, to make health care more affordable. In fact, President Obama promised that premiums for families would decline by an average of $2,500 per year. The reality has been very different. Today, average annual family premiums in the employer-sponsored market have soared by roughly $4,300 since 2010, and deductibles are up an average of 60% since 2010 in the employer-sponsored market. Some of this increased cost is, of course, attributable to the increased taxes and mandates that are part of Obamacare. But much of the healthcare inflation that we've been seeing both before and since enactment of Obamacare is attributable to the litigation lottery environment and the failure of Obamacare to address the problems in the tort system, I think, is one of the core problems of Obamacare. We believe that Americans deserve healthcare reform that will help actually lower the cost of care and protect the sacred patient-doctor relationship. And I appreciate the fact that the American Healthcare Reform Act, this alternative to Obamacare, includes legislation that I introduced called the Saving Lives, Saving Costs Act. And the purpose of this bill is to deal with the fact that over the course of their career, 75% of physicians will face a malpractice claim, and this liability climate is driving overutilization. It is causing defensive medicine, and that's increasing the cost of care for many Americans. Our bill would allow physicians who can demonstrate that they follow clinical practice guidelines, peer-reviewed clinical practice guidelines developed by the physician community, to benefit from increased liability protection in the form of a legal safe harbor. By reducing the practice of defensive medicine and increasing adherence to evidence-based medicine, we believe this legislation will lower healthcare costs while improving the quality of care for patients. And in fact, the Congressional Budget Office has estimated in the past that liability reform like this would yield savings up to $65 billion over 10 years. And this is an innovation on previous efforts to reform our malpractice system in that this is not caps on damages, and this honors federalism. So I appreciate the opportunity to be part of this important initiative. And now I'm going to yield to the former chairman of the Republican Study Committee, Bill Flores.
Thank you, Andy. I want to thank each of you for joining us this afternoon as we roll out an exciting new plan that's based on patient-centered solutions and free market principles. We all know Obamacare's failures are hurting Americans' health care security. Premiums are continuing to skyrocket, co-ops are collapsing, and insurers are abandoning marketplace, leaving Americans with fewer health care choices and higher cost. In November, the American people voted clearly against the president's agenda and Obamacare. Despite the will of the people, President Obama huddled with Democrats this morning for a last-ditch effort to save Obamacare. And today, the RSC has put forth a replacement that empowers consumers, improves access to care, and lowers the cost of health care. The RSC's American Health Care Reform Act is a bold plan that will lower cost, expand access, and increase competition in the marketplace. It allows individuals and families to choose the health insurance plan that works best for them, while encouraging insurers to earn their business by offering affordable, competitive plans. It will continue to protect those with pre-existing conditions and expand access to the health care market by allowing people to purchase health care across state lines. Last year, a repeal of Obamacare made it to the president's desk only to be vetoed. With our new unified government, we can finally see this disastrous law repealed. Now, despite the president's rhetoric that you heard this morning and the rhetoric of those across the aisle, this is not going to eliminate health care coverage for millions of people that are currently insured. Our plan provides for a smooth transition from a failed plan to one that will work. No one loses coverage, doctors get paid, insurance companies continue to issue policies, albeit on a more competitive basis. And it provides for that stable transition. It's time for hardworking American families to be empowered to make their own health care decisions, not Washington bureaucrats. Thank you.
I'm Dr. Brian Babin. I represent the 36th District in Congress, and I practiced dentistry in East Texas for 36 years. And this has been a problem for the American people for 6 long years now. The American people are drowning in excessive cost and regulation of Obamacare. Americans cannot bear another year of rising premium costs, loss of coverage, and lowered quality of care. The time to repeal this is now. We have a plan that will repeal Obamacare immediately and put an affordable, patient-centered system in its place. This is what the American people need: immediate relief and a backstop replacement to back it up and have it in place. This plan would expand access to health savings accounts, which I have personally still after several years, allow the purchase of insurance across state lines, as you've already heard today, as well as several other reforms that will drive down the cost of medical care. In November, the American people spoke loud and clear on several issues, and their health care, our national health care industry and system, is nothing short of being at stake here. And this is what this plan is all about, and I'm very honored to have been included with this very diverse group of ladies and gentlemen up here who have come up with this good plan, and I want to thank you.
Hi, I'm Marsha Blackburn. I'm from Tennessee. And as Dr. Rose said, we've already been to this dance, if you will, and lived through this issue. It was with the test case for Hillary Care, which was TennCare. And as Dr. Rowe mentioned, back in 2010, we wrote an op-ed saying, if you pass this, let us tell you what is going to happen. And much of that has come true. Now, one of those lessons that we learned from TennCare was that even when you made health care available through a government-run program, people did not buy it. They did not opt in or sign into this program. And what they wanted to see was an affordable option that would allow them to buy the type insurance that they wanted at a price that they could afford. So that is why in 2009, I started working on the across state line purchase of health insurance, opening up the health insurance marketplace that will allow you, the individual, to be empowered to buy the insurance you want, the coverage you want for your family at a price you can afford. That is how you get down the cost of health insurance, and that is also how you will increase access to health care, because individuals will choose to get into the healthcare marketplace. One of the lessons we need to realize, and one of the reasons we are bringing forward the American Healthcare Reform Act, is this. At this point in time, you have 23 million people that are involved in the Obamacare universe, if you will. You've got 11 million of those that are in the exchanges. Now, about 7 million of those people had private insurance. They got forced into the exchanges. And then you have 12 million that went into Medicaid coverage through the Obamacare program. So what you have is a system that 7% of the population is involved with Obamacare, and 93% of the U.S. population feels like their health care service has been disrupted. It has become too expensive to afford, and when you get the insurance, it is too expensive to use because of the deductibles. So I commend my colleagues. I'm happy to stand with them, and so pleased that, again, the RSC is taking the lead and bringing forth another option, putting it on the table and saying, let's consider this as a new way to approach health care. And I yield to Austin Scott.
Thank you, Marsha. One of the things that Marsha brought up that I'd also like to mention is the percentage of people that were hurt by this. Approximately 95% of Americans did not benefit in any way, shape, or form from the health care bill, and in fact, paid significantly higher premiums and cost after the law was passed. As somebody who was in the insurance industry for a long time, one of the things I can tell you that must be changed is the McCarran-Ferguson provisions. The fact that Barack Obama and the Democrats left the insurance industry exempt from the antitrust laws of the country, to me, is proof that they didn't intend to resolve the problems. How could you give American citizens a mandate to purchase from the one industry in America that you left exempt from the antitrust laws of the country? What we have, I believe, is a direct result of that preference that was given to that industry. And one of the key things that this bill does is remove the antitrust exemptions that the health insurance industry has enjoyed.
Well, thank you. My name is Buddy Carter. I am a representative from Georgia, currently the only pharmacist serving in Congress at this time. And folks, before I became a member of Congress, I served in the healthcare as a pharmacist for over 30 years. And I can tell you, I think we have the greatest healthcare system in the world. I still believe that. Even with this train wreck that has happened with Obamacare, if you're sick, you don't want to be anywhere else in the world except right here in America. That's where you want to be to get the best health care coverage that you can get. But folks, right now we've got to resuscitate our health care program. We've got to resuscitate it because of what Obamacare has done. And I've watched it firsthand. As I said, before I became a member 2 years ago, I practiced pharmacy for over 30 years. And what I witnessed in pharmacy was nothing short of miraculous. I've seen advances in pharmaceuticals that have been life-saving, that have brought us to the point where now we're looking at a situation with pharmaceuticals that we've got to address, because even though they are life-saving, many of them are not affordable. And this is something that we've got to address, and we've got to address it through transparency. That is so vitally important, not only in pharmaceuticals, but throughout our healthcare system. So transparency is going to be a very important part of what we're talking about here. What we want to do is to try to get the free market back into healthcare. The worst thing that Obamacare has done is to take the free market out of health care. Adam Smith must be rolling over in his grave right now to see what has happened here. We've got to do that. We've got to have affordable, accessible, and patient-centered health care, where patients and physicians and healthcare professionals are making decisions about their health care and not insurance companies. That is something that's going to be very, very important. So I want to thank Chairman Walker. I want to thank the co-chairs, Dr. Rowe, Austin Scott, and everyone here for what they've done in this, what I think is a great proposal, and what we're going to be working on, again, to bring accessible, affordable, patient-centered health care back to our healthcare system. So thank all of you, and God bless you.
Thank you. As we prepare for a few questions, I know we've got votes coming up, but I want you to look at the people up here. I know you see them as congressmen and women, but you see physicians, dentists, pharmacists, healthcare attorney providers, people who are hearing from the constituents and American individuals across this country saying, listen, please help us. We've seen the damaging effects of this. With that, I'm going to open it up. I asked Dr. Wood also to come up here and stand with me, and we'll take a few questions before we have to transfer over for votes here. And if you would, just identify your name to the right here.
Neil McKay from Breitbart. Is the key function going to be premium support? What is going to be the key function that makes it different from the process we have now? There are a lot of differences. A premium support is where you have money coming from somewhere, whether it's in your like when I was an employer in my practice, I provided so much of the premium, and the employee provided so much, and there was a copay. You let the markets decide that. What we did, and I did a poor job of describing this 8 years ago, when the debate was first going on about pre-existing conditions, and so we all agree on that. We probably all up here agree on rescission and lifetime limits. Those are not things we're going to debate actively on. I think everybody agrees on that. But this allows the free market system to actually work. Right now in my state, 70% of the counties have one provider. That's not competent. It did the opposite of what we thought it would be. Premiums in my state, Tennessee, was not a rich state, went up 62% this year on the exchanges. And in my hospital system at home, which is a large system, a medical school, a branch of St. Jude's Children's Hospital. I was on the clinical faculty of the medical school there. 60% of the uncollectible debt in that system plus are people with insurance. You didn't hear me wrong. With insurance, not without. So they don't have anything. If you make $35,000, $40,000 a year, and you have a $6,000 out of pocket, you don't have anything. And people are getting denied care because they can't afford the out of pocket. And providers like me in hospitals are having to eat that or provide the care for nothing for patients. I want to say one other editorial thing. I've been here now 8 years. I never understood this, why health care is a Republican or Democrat issue. Look, I've never seen a Republican or Democrat heart attack in my life. I've never operated on a Republican or Democrat cancer in my life. I have delivered a lot of Republican babies, I will tell you that, where I live. But seriously, it's something I've never understood, and I did not understand. I've been a doctor 46 years. And when I came here, I thought somebody cared what that experience meant. I was not asked one thing. There were 9 physicians in the Docs Caucus at that time. Not one of us was asked one thing about that health care bill was passed. It's one of the reasons it's a disaster right now.
Just real quick, I'm sorry. But the concern is the 7% that is affected, right? 93% of Americans are covered. How do you address that? Is it what people are worried about is the free for the 7%? How do you catch them?
Now, I'm not sure I follow your question. In other words, what do you do with the people?
If 93 or 95% of Americans aren't even affected by Obamacare, didn't even need the Obamacare reform, and say 5 to 7% are the ones that are affected to get your universal coverage, how do you avoid the free fall for those 7%?
Well, that's a very tough question. Right now, you have 155, 160 million people covered by their employer. And one of the ways to make it better is get more employers. That would help. Actually, no more people with an expanding economy have health insurance through their employer than 8 years ago. That's never happened, and I know in our history. When employment's going up, health care coverage goes up. 57 million people get insurance through Medicare, and now 73 million people get insurance or they get a card through Medicaid, which is a failed system. And by the way, I guess Marcia had to leave, but exactly what happened in TennCare reform is happening here. Guess what the Medicaid cost was? 50% more than they thought. 50% more. The exchanges this year, the subsidies this year are up from $32 billion to $42 billion, up $10 billion. So there are a lot of, this bill is amendable.
And I would add, it's a false pretense that Obamacare has protected and covered everyone.
Yeah.
9% across the country, 11% in North Carolina, my home state, still don't have insurance. So even starting from that pretense or that argument is fallible even to begin with. Let me go to this young lady to your right here. I don't know that we're opposed to anything, and there are several options on the table. As Speaker Ryan has said over the last 2 weeks, repeal is relief. When you hear from the amount of small businesses and individuals, I can guarantee you the stories behind me of constituents contacting them, there's something immediate that needs to be, we've got to put out the fire immediately. We haven't put a timeline on the replacement side of that. We also have to make sure that we understand the reconciliation aspect. Many of us worked hard in the 2015 114th Congress to make sure that we were able to, that 51, the simple majority threshold under reconciliation. We want to stay within those bounds to make sure that we're to alleviate this fiscally and horrible financial burden on the American people. So a little bit of your question is based on anticipation. We don't have the full timeline as far as replacement, but we want to make sure that we can do what we can do immediately, and that is make sure that we're repealing the Affordable Care Act.
And just one other comment for the chairman. I heard it again on the House floor when I was down there right before I managed the bill just a few minutes ago about how Republicans have no ideas. That's absolutely false. We have a plan, a 185-page plan. It will not be the exact, it's amendable. I haven't written the perfect bill. Austin Scott, this group didn't write the perfect bill. I'm willing to listen to Democrat ideas about this, to amendments to this bill, as opposed to what they did, which completely shut the other side out.
Yeah, we're even open up to markups. We've got a retreat coming up ourselves on Monday and later in January as well to fine-tune the process. What we're saying, as I talked about earlier, we've got to get out there. We've got to get runners on base. We've got to bat lead off because our response, and I guarantee you, most of us on this stage, we made a promise to the American people that we would work diligently. Just like this may not be the final, whether it's coming from the administration or coming from other leadership in our conference, we're wanting to make sure that we're working together. But our job is not to delay any longer. Our job is to come out of the gate with the particular piece of legislation that garnered more votes than any other legislation in both the 113th and 114th Congress. In the back, Mr. Yes, sir. There's no perfect solution in that. And let me speak just from the heart, from a personal standpoint. I was a pastor, a couple large churches over the last 2 decades. I've worked in refugee camps. I've worked in the inner cities of places like Cleveland, in New York, and Baltimore. My wife is a nurse practitioner, emergency nurse practitioner. We've been many places. We've seen the hurt. We've seen the pain. And one of our approaches is not just to try to come up with good policy, but is to have the right approach, the right heart, and the right voice. We get it. We understand it. There may be no perfect solution, but if you look at specifically just the raw numbers from nonpartisan, and then I'm pulling this number from my head, I believe this is correct, 15% of the people did benefit in some way in the country. 25% were damaged. They were hurt. So if we look at those numbers alone, for us to ignore that and not to react to do something we would not be doing our jobs. So we have to move forward something. Now, there's nobody up here that's advocating that we yank the rug out of anyone. This will be a process that we look forward. This is the beginning piece. This is round one of making sure that we're taking on the parts that are the most damaging to both small businesses, to individuals. Think of a friend of mine back home has 92 employees. They've been reducing employees. You look at the people that work in the restaurant businesses, a lot of them have lost full-time jobs. These are the people that we have to stand up and be their voice. Over time, we will look forward to putting together something that maybe can create, nobody's up here is looking to strip, as I said, remove the rug from anybody, but to sit here and say right out of the gate, we've got every perfect solution for every single individual in full transparency. There still may be some that fall through the cracks. That's not our intent. But our job is to go back and let the patients, let the people begin to choose once again to be able to have decisions providing for their own health care as opposed to bureaucracies dictating what they should be having. Maybe 2 more questions, then we have to wrap it up.
Let me suggest to you this, is that as many people elected to pay a fine, penalty, tax, whatever Judge Roberts wanted to call it, than did get a subsidy. 8 million people opted, they made a decision that this costs so much that I can't afford it. And I found this amazing in America that you will find somebody for something they can't afford. We've never done that ever before. And we did that with the Affordable Care Act.
Okay, 2 more questions on this side right here. Let me go, the young lady, and then the front here will be done. Yes, ma'am. Bill, do you want to address that?
It's a very similar bill, and you're right. We called our, 2 Congresses ago, A Better Way for health care. The 21st Century Cures Act did address some of the issues that was in the previous bill. So that article and section was removed, but otherwise it's basically the same bill.
All right. 1 more down front, and we'll need to wrap it up.
There's a lot of fear that the individual insurance markets might collapse in the interim as Republicans kind of craft and enact a replacement plan. Would you be open to anything to kind of stabilize those marketplaces in the interim period?
You mean collapsing faster than they're already collapsing? Yeah. Okay. Phil, do we have, from an interim standpoint, I believe that the markets are collapsing and premiums are soaring to the place, which creates the urgency. That's why we're here today. That's why we're moving quickly. It's hard to speculate or anticipate on what may or may not happen. What we have to do, and certainly don't speak for everybody, but we have to do what we're called to do, what our job is, and that is to move at an urgency that allows the full repeal to take its place. Remember this is built on the premise that you cannot refurbish a healthcare system that's been built on a broken foundation. And that's what we're here to do today. Thank you guys for coming out. Appreciate your questions. God bless. Have a good day.